So newborns generally have symptomatic seizures. It's very rare for a newborn to have idiopathic seizures. Generally, they're symptomatic. And on the left, you can see common causes of newborn seizures. And what I mean by metabolic imbalance is something that's easily corrected in the newborn period. So their electrolytes are off, their blood sugar's low. And when you correct that, the seizures go away. That's very different than an inborn error of metabolism, like congenital hypothyroidism or metabolic disorder. Those are lifelong. And so there's a big difference in outcome between those two issues. The types of seizures that kids can have, so clonus is shaking. So that clonus, you can see that in babies. Again, most infants, most newborns, hypotonia is more common. So clonus usually happens for kids with high tone. If you see clonus in a newborn, you have to think about seizure right away. So clonus is that fast kind of shaking. Myoclonus is a type of movement that happens when you're falling asleep. Do you ever get a sudden muscle jerk that kind of wakes you up? That's myoclonus. You're not having a seizure. That's a normal thing called sleep myoclonus. But that's exactly what a myoclonic seizure looks like, just a brief little jerk. And so infants, newborns, are prone to myoclonic seizures. Tonic seizures are stiffening. And if you've heard of generalized tonic-clonic seizures, you see tonic seizures with stiffening and then clonus. So you get both of those with generalized tonic-clonic seizures. And then newborns also have what we call subtle seizures, which are those autonomic issues, drops in heart rate, abnormalities in blood pressure, apnea, those kind of things, especially in the newborn nursery. If you work in that kind of environment and you see those kids with vital sign instability, eventually seizures on your differential for those kids.